Good evening, ladies and gentlemen. Thank you so much for joining us this evening. It's my great privilege and pleasure to introduce the esteemed panel that we have today. The Honourable Minister of Health and Family Welfare, Shri Mansukh Mandaviya ji, Secretary Health and Family Welfare, Shri Rajesh Bhushan ji, Director General ICMR and Secretary Department of Health Research, Professor Balram Bhargav ji, Additional Secretary, Ministry of Health and Family Welfare, Dr. Manohar Agnani ji, Joint Secretary, Health and Family Welfare, Shri Love Agarwal ji, Dr. Rodrigo Offren, WHO India representative, Ms. Anjali Kaur, Deputy Assistant Administrator for Asia in USAID, based in Washington, D.C., Mr. Yasumasa Kimura, Deputy Representative, UNICEF India, Ms. Shoko Nada, UNDP Resident Representative, Mr. Takio Kunishi, Country Director, ADB, the Asian Development Bank, and Dr. Chris Elias, President of Global Development at the Bill and Melinda Gates Foundation. And also welcome all the rest of you. This is our first Aksha event since November 2019. We had set up Aksha as a platform for sharing innovations, solutions, and ideas related to health and development. And it feels very apt to have the first event since 2019 to focus on India's tremendous successes with COVID vaccinations. What India has achieved over the last year plus in delivering over 1.8 billion vaccinations across the country is one of the most, I'd say, mammoth, immense, and special public health achievements of our times. And the idea today is to really hear from the people who've been driving a lot of this change on their experiences, stories, so we can distill some of the lessons for public health delivery and pandemic preparedness. With that, I'm going to request the Secretary, Health and Family Welfare, Shri Rajesh Bhushan ji, to share his thoughts and experiences from having been at the helm of India's COVID immunization success story. Over to you, sir.
Honourable Minister, Health and Family Welfare, Government of India, all the luminaries seated on the dais, ladies and gentlemen, this interaction provides us an opportunity to share experiences of India's COVID-19 vaccination journey. Since most of you would be interested in listening to Honourable Minister's point of view and the inputs from other esteemed colleagues who are on the dais, I would be brief. When I interact with you, we have covered almost 96% of 15 plus population in this country with one dose, and 82% of 15 plus population in this country with both the doses. And for a country of India's size, that is a huge and significant achievement. When we look back and reflect, then there are certain things which are absolutely crystal clear. What works? What works is the government being proactive. And what is the best example of government's proactiveness? As early as May 2020, the Prime Minister constituted a task force on vaccine, diagnostics, and drugs for COVID-19, which was headed by the principal scientific advisor to the government. May 2020, not many countries were thinking in terms of having such a focused mechanism which would then provide propulsion or impetus for development of vaccines or diagnostics or drugs within the country. Then, in quick succession, in August 2020, the Prime Minister set up something called NEGVAC, which is the National Expert Group on Vaccine Administration. Both are closely linked. One body to encourage domestic R&D and manufacture, other body to actually roll out vaccination and look at the granular details of how vaccines would be administered. So what works is for the union government or the federal government to be proactive from day one. What else works? What works is to have an army of health foot soldiers. India has more than 1 million Ashas, accredited social health activists in our villages. India has more than 300,000 auxiliary nurse midwives. These were the people who proactively addressed the issue of vaccine hesitancy in certain geographies and vaccine eagerness in other geographies. You cannot and you must not leave this exercise, which is as mammoth and as complex as a pandemic vaccination, to private entities exclusively. So the government has to play a role, and the various grassroots workers of the government have to play a role. It helps if you have that kind of grassroots organization already available, which can then be repurposed. However, if you are dependent only on, say, health insurance or entities dealing with health insurance, then your challenges are totally different. So this is the second lesson that we have learned, that it works to have a huge network of grassroots health workers. What also works is to have a very robust immunization program, because then that mechanism of cold chain, of supply chain, of vaccinators, of verifiers can be repurposed, can be utilized for COVID-19 vaccination. On an average, on any given day, when we were vaccinating, say from June 2021 to January 2022, on an average, more than 100,000 vaccinators were working every day. 1 लाख वैक्सीनेटर पूरे देश में औसतन हर दिन काम कर रहे हैं. And these vaccinators were not alone. They were accompanied by a team of 4 people. So a team of 5 people, including the vaccinator, at various vaccination centers, whether government or private, they were all working. That is what made this mammoth exercise possible. And lastly, what works is to have a very robust and very strong digital platform. Each individual vaccination event in this country is digitally captured. A digital certificate is generated with a specific QR code, and this was a platform that never ever crashed in the last year and a half. So that is a testimony to our IT people, most of whom are very young and fully dedicated to this task. So I would not take too much of your time. These were some of the learnings from this enterprise, and I'm sure other colleagues would supplement whatever I have said. And once again, I thank you for providing us this opportunity to share our thoughts with you. Thank you.
Thank you for your remarks, sir. I would now like to invite Dr. Balram Bhargavji, Director General, Indian Council of Medical Research, to share his perspectives with us.
Our beloved and honourable Minister of Health, dignitaries on the dais, illuminaries in the audience, ladies and gentlemen, it's a pleasure to be here, that we are celebrating our 1.8 billion doses. This journey has been a fantastic journey, a great learning experience, not only for India, for the rest of the world, that India can do it. We have been able to do innovation, research. Our scientists, our researchers, our healthcare workers have all delivered in this pandemic which the world has been groping with. And we have clearly demonstrated that India is not only the pharmacy of the world, but is now well established as a vaccine superpower. And I think that is very important to remember, that we have now established that not only as for production of large quantities, but also for discovery and innovation of vaccines. And that is probably the most important aspect that has been established. We know, and my previous speaker has talked about the numbers, but our universal immunization program for the last 6 decades has been the backbone for the delivery of these vaccines. More than 350,000 vaccination centers have been the backbone for the delivery of these vaccinations. A delivery of a vaccine which is 2 to 8 degrees by drones to remotest parts of Northeast has been the backbone of this, and the number of people that have contributed immensely. But what it shows is that now we have a great journey ahead for newer discoveries, for newer vaccines to be delivered, for newer, and India to play a much, much greater role in the world for this vaccine for various diseases, not only for children, but also for adults. And with these are some of the points that I wanted to say, and Jai Hind, thank you.
Thank you, sir, for sharing your perspectives. I would now like to invite Shri Love Agarwal ji, Joint Secretary, Ministry of Health and Family Welfare, to share his presentation on India's COVID response and vaccination journey.
Honourable Minister, sir, dignitaries on the dais, and all our colleagues who are present in this workshop celebrating India's journey for vaccination. I would like to run all of us through in terms of what had been India's approach and what had been the result which India had been able to achieve overall in terms of our public health response for COVID-19 management, with specific focus on vaccination drive which India has taken. Dear colleagues, as you're all aware, we are still seeing a large resurgence of Omicron variant across the world. And as on today also, we see around 57 million active cases across the world, and an average cases of around 1.76 million cases still being reported, and which is higher than the earlier peak which world has observed in 23rd of April 2021. Equally important, the point to submit here, that we also realize that even now there are countries where we are seeing a sharp upsurge, whether it is South Korea, Vietnam, France, UK or Australia, where multiplication factor of the COVID-19 cases is as high as 2 or 3. And to that extent, we realize that the present surge is still at a very critical juncture. And we had seen the highest surge of around 4.23 million cases per day, which is actually around 4.68 times higher than the previous surges which world has seen so far. So this was the level of challenge which India as well as countries across the world had when it comes to this present resurgence. But I'm also happy to highlight that if we see the present surge, we had the highest number of cases was much lesser than even the second surge, vis-a-vis 414,000 down to 347,000. And again, happy to highlight that the continued focus in terms of the collaborative effort, which Secretary Health Sir did mention, we are able to ensure that we are able to restrict the trajectory to as low as 1,549 cases presently. I would like to submit here what has been our approach in terms of overall COVID-19 management, and most important of has been the institutional response, the insightful leadership at the highest level in the country, where not only monitoring and oversight is provided, the collaborative effort of how we can work together with all stakeholders, including Honourable Chief Ministers of State and State Health Ministers. How do we work with community in terms of Jan Andolan and also the Jan Bhagidari, because this is again, we had realized in this country that will be a most crucial element of management of any infectious disease. Equally important, as Secretary Sir did mention, was to focus on our healthcare workers and frontline workers who supported country in terms of overall management. The focus on Make in World, Make in India and Make for World has been one of our major stay, whether it was logistics, drugs or vaccines. And I would like to also highlight, as and when whatever decisions were required to be taken, whether it was the decision related with lockdown, whether it is the decision related with unlocking the country and reviving the economy and providing solace to the poorest man at the cutting edge level, all the decisions were taken right time. We created an institutional framework. Just to summit, we had group of ministers, we had joint monitoring group, we also had committee of secretaries headed by cabinet secretary. Multiple empowered groups were formed, which were headed by secretaries. They were given the power of cabinet in terms of taking decision. And again, whether it is public health expert related national task force, whether it is national expert group for vaccine administration or advisory group on immunization, all these technical groups provided us critical support in terms of both clinical management guidelines as well as the vaccination approach. Again, whether it is genomic sequencing, it was all those efforts which had happened in the right time. If I were to summarize this, I would like to specifically submit the focus was on preemptive approach, understanding what needs to be done and doing it in right time. Equally important was focus on being proactive, whether what is happening in the global, what is happening within the country, what is happening in every district of the country was analyzed and is regularly analyzed on a daily basis, even presently also, in terms of case positivity, in terms of overall number of tests being done, and also number of cases which have come, and what is the health infrastructure upgradation. Every analysis is done in real-time basis so as to identify what needs to be done. Challenges were posed by COVID-19, and India responded to all those challenges in right time by grading our response based on the type of challenge which was put on us. And equally important, the focus on whole of government, whether it is national government, whether it is state government, whether it is local government, the country worked in unison. What I would like to submit here is that it was a team India effort. Whole of India effort is what has actually supported in terms of overall management, and we also worked with community in terms of ensuring that their support, religious leaders, community leaders, everyone stood with Government of India in terms of making that impact. We are primarily discussing today in terms of our vaccination effort. I would like to submit that we took vaccination in a mission mode at a scale which is totally unheard of across the world. And this is how India has worked, whether it is vaccine development, whether it is regulatory support, whether it is ramping up production, or administrative approach in terms of how the vaccines have to be administered, and including the logistic management, just-in-time approach of ensuring that for more than 1 year, 3 months, consistently without a single complaint across the country, we are able to not only deliver vaccines, we have been able to administer them without any lockout, without any situation where there is even single complaint on a regular basis India has been able to manage. I would like to specifically highlight, it was very important to focus on communication with community. And that is where we worked in terms of ensuring that COVID appropriate behavior remains our mainstay. We also focused on ensuring that targeted communication is done with community with respect to how much vaccines are available, how do you access vaccination schedule. We also focused on ensuring that the right evidence-based information is made available to community in terms of what vaccines are approved, what is their safety parameters, and also what is the efficacy of these vaccines so that we can actually enlist community support. We had equally an important challenge in terms of both managing vaccine eagerness as well as vaccine hesitancy, and I'm happy to submit and highlight that the testament of the efforts done by Government of India is in terms of number of doses which India has been able to deliver consistently for more than 1 year, 3 months now. We enlisted everyone's support in this country. Secretary Sir talked about healthcare workers. I'm also willing to highlight specifically that every component of community, healthcare worker, frontline worker, everyone ensured that on a regular basis the vaccination drive takes place in this country. The scientific approach which India has taken in terms of prioritizing what age group and what comorbid groups to be taken in terms of vaccination is what again has supported country in terms of taking the initiatives forward. We started with healthcare workers and frontline workers. We went down to 60 years of age group, and parallelly after that we went down to 18 plus age group. Equally important, I would like to submit the focus on that every vaccine has been made available free to every citizen of this country by government on a continued basis. And today, when the new variant of Omicron came as a new challenge in front of the country, based on the scientific advice, whether it is adolescent 15 plus age group, 15 to 18 group, whether it is precaution dose for healthcare worker and frontline workers and people above 60 years of age, and now presently 12 to 14 year age group, Based on the scientific evidence, based on the challenge posed, country has taken those right decisions and ensured that we are able to manage the situation. I would like to specifically highlight this slide, something which Secretary Health Sir has alluded to. It is not an easy task to administer a vaccine, and that too at such a large quantity on a daily basis. Kindly understand, let us understand this. Once the vaccines are made, after making a vaccine, it has to be batch tested. After that, it has to be sent to the government medical stores available at state level. Subsequent to that, it has to go through refrigerated vans to district level vaccine store. From there to primary health center, and then after that a vaccination team that again, so this requires managing 28,934 cold chains on a daily basis. And again, it is a highlight to submit here that till today, nowhere such breach has happened where country had faced any problem in terms of management. Not only this, it is equally important. How do you leverage technology to ensure that you are able to do planning for sessions which are taking place, thousands and thousands of them are happening on a daily basis? How does the beneficiary register? How does that beneficiary get vaccinated? How is he reminded that your second dose is due on this date? Kindly reach to that particular vaccination center. How do you monitor adverse event following immunization, which is a very critical element of any vaccination effort? And I am happy to highlight that the day when country launched the vaccination drive in this country, we gave a QR coded digital certificate to every citizen for every dose delivered. This is where we have not leveraged technology, we have leveraged human resources in this country, which had worked on total commitment mode in terms of delivering all the vaccination doses which we have been able to do so far. Critical was also to focus on vaccinating the last mile. We all know the type of challenges which country of this magnitude and the geography which we have poses to the country. We ensured that we had more than 100,000 vaccinators which are oriented through online training platform. 65% of our vaccination centers were primarily based in rural areas. We followed a just-in-time approach. Again, it is not the vaccines alone. Syringes, training, every component of the vaccines supply and management was oriented, whether it is near to home vaccination centers, whether it is innovation like workplace vaccination centers or mobile vaccination teams. All these approaches were followed by this country to ensure that we are able to go to the last mile. Elderly person who is not able to come out of his home, an 80-year-old person could also access vaccination mobile team visiting his home, and vaccination was oriented and tied up for that particular person. I would specifically like to submit Har Ghar Dastak. In English, it would mean knock on every door. The healthcare workers of this country, the vaccinators of this country had gone and knocked on each and every door of this country to ensure and to talk to people, why have you not taken a vaccine if you have not taken? If you have taken the first dose, when your second dose is due, why are you late in terms of taking second dose? It is these efforts, it is this mammoth effort which has supported country. And again, these unsung heroes, which we should really bow our head to, whether it is crossing mountains, whether it is crossing desert, this has happened in this country on a daily basis. Dear colleagues, I would also like to submit, not only when India worked on vaccinating the country, India also focused on Vaccine Maitri, Vaccine Friendship Initiative, where we provided vaccines to 99 countries across the world. Parallelly, we also ensured that our COVID platform, which supported us in terms of management of vaccination effort, we have made it available as a global good so that any country need not reinvent the wheel and they can take up their vaccination drive in a much more smoother manner. Few specific points I would like to submit is that India surpassed its own achievements with time. We did 250 million vaccine doses in 145 days, first of all. We reduced this time to 56 days. We further reduced it to 34 days to ensure that right now, I am proud to highlight that we have done 1.81 billion doses of vaccination. The figures are for everyone to see. I would not like to highlight these figures, but I would just like to run through primarily the challenge which had been posed to us by Omicron. I would like to specifically highlight, kindly see, multiple projections had highlighted that Omicron can lead to cases as high as 1 million per day. There are projections based on what had happened in other parts of the world. If I take France, US, and UK, and if I take their population, the peak of cases they have observed, then the challenge in front of India was that we could have got as high as 10 million cases per day. But it is the focus on containment, coupled with clinical management, and the mammoth efforts of vaccination which has supported this country in terms of the fact that we are able to reduce the peak to as low as 347,000 cases only per day. I would not like to highlight specifically what the efforts have been done because I have talked about them, but I would specifically like to highlight whether it is Honourable Prime Minister, whether it is leadership given by Honourable Health Minister in terms of daily review. Every day, 9:30, all experts and all administrative officers sit under the direction of Honourable Minister. We analyze the trajectory across the globe. We analyze the trajectory across India and identify what field action needs to be done. I think this is what has supported to us in terms of ensuring that we are able to enlist support of everyone and go ahead. I would like to again further submit, I know that time is too less, but again, trying to summarize this journey of once in a century event in such a short time probably will not be doing the required justice. This presentation will make available for all colleagues to see. But again, just to submit to you, if you see how second surge and third surge had happened in this country, kindly see the blue diagram, the blue line indicate how vaccination has progressed across the country. And if we see second surge and third surge, I'm only willing to specifically focus on one aspect here. We not only ensured that we had lesser number of cases between second surge to third surge, we also ensured that our vaccination efforts of 90% people and 65% people having first dose and second dose, which has supported that the number of deaths, and as we always say in this country, every death is a cause of concern for India. But the number of deaths which had been reported in this country was only 16,570 if I remove the reconciled deaths. And the consistent focus on clinical management effort, India had been able to manage the situation of Omicron variant with a case fatality rate of as low as 0.02%. Further, again, this is the situation of world. I would not like to take much time on that, but I would just like to submit specifically a point here that if we compare India's response during Omicron vis-a-vis what has happened in the world, the only point to highlight is on an average 0.45% has been the case fatality rate observed across the world in Omicron variant. And the Omicron variant threat of Omicron variant has not gone away from India. But India had been able to manage successfully as high as 23 times that of world's overall management of COVID-19 when it comes to saving precious lives. This is the situation again with USA and France. Again, I would like to submit whether it is number of cases which have been reported in this country, whether it is number of lives which have been saved, consistent efforts of our healthcare workers, frontline workers, provided the institutional response in terms of management of Omicron. Specifically to highlight, if I were to compare ourselves with world today, overall COVID-19 management, not only the third wave, again I'm happy to highlight only 3.16% of India's population has been positive so far. Vis-a-vis world, it is 5.98%. Similarly, cases per million, 59,280 versus 820 versus 31,555. Whether it is deaths per million, again similar situation. 377 deaths reported per million across this country, vis-a-vis 775 deaths per million reported across the world, and case fatality rate of 1.2% cumulative, vis-a-vis 1.3% of the world. And I would like to sincerely submit 0.001% also makes difference in terms of thousands of numbers for the world at large. Dear colleagues, again our vaccination journey, we had been able to administer largest number of vaccines. I would not like to give these figures, but I would like to highlight that when we compare ourselves with other countries, with smaller population, their challenge was much lesser. With the geography which India had, their challenge was much lesser. But India has been able to successfully work on this aspect. The only point I would like to sincerely submit, the concept of seva in this country. How do you celebrate the Prime Minister's, Honourable Prime Minister's birthday in this country? Do you give him flowers or do you give him a gift which conveys that this country, every healthcare worker is sincere and serious about saving these precious lives? We had 2.5 million doses given on Honourable Prime Minister's birthday last year as a testament to the concept of seva which India has imbibed in itself. And I'm happy to highlight that this is equal to the population of Australia. This is what India has done. Since the onset of pandemic, we had, as I submitted, we had focused on being proactive, preemptive, and graded. And we focused on vaccine development through utilizing our low-cost research and as well as multiple collaborations across the world. We are still aware that the challenge and threat exists even now for the country. We are aware of it. We follow the same approach of test, track, treat, vaccination, and follow-up adherence to the COVID-appropriate behavior as our mainstay. And I'm happy to highlight that India, under Honourable Prime Minister's direction, under the directions of Honourable Minister, has followed our own concept of Vasudhaiva Kutumbakam, our Indian philosophy, as Honourable Prime Minister Sir mentions, one earth, one health. And India is always willing to contribute, work with other countries of the world to ensure that not only we save precious lives in this country, but we also make an impact of life in the life of everyone in this world. Thank you very much.
Thank you, sir, for the insightful presentation. I would now like to invite Dr. Rodrigo Ofrin, Country Representative, World Health Organization.
Dr. Mansukh Mandaviya, Honourable Minister for Health and Family Welfare, dignitaries on the dais, friends and partners in the audience, and maybe we don't have an Aksha here, but it's also a very good evening for Akshas and frontline health workers. First of all, congratulations to the government of India for these achievements. You've heard it, and thank you to the Bill and Melinda Gates Foundation for having a platform such as this. I think let's begin with numbers. 1 billion doses in 10 months, 1.8 billion doses in around 14 months. It's 25 million vaccinations in a single day, which is the population of Australia. Vaccines delivered at over 450,000 vaccination sites across the country. 160,000 trained vaccinators deployed for COVID vaccination. Indeed, WHO is a privileged partner. This job, I always say, it's a privilege more than a very challenging or a huge responsibility. And many of what we're able to do is because this is India. All our field officers, 2,600 of them, were repurposed to support this vaccination drive. Even other parts of the response, especially surveillance. Over 475,000 COVID-19 vaccination sessions were monitored. More than 2.9 million beneficiaries monitored through community monitoring. This is also a big difference of how India monitors its vaccination. You go house to house and speak to the beneficiaries. Over 75,000 program officers, 730,000 health workers, 160,000 frontline workers trained. Development of a second version of SafeVac to be incorporated in a one platform of COVID. And maybe it's not really directly connected with the vaccination effort. It is right now, 37 states are implementing the Integrated Health Information Platform since its launch in April 2021. To date, 11 million syndromic and 14 million presumptive cases of certain diseases have been reported through that platform. Of more than 10,000 alerts, 800 have been investigated. From ICT apps to traditional house-to-house approaches, applying these tools to a future pandemic or any disease elimination effort, and we can all understand that to work in India is to work to scale. Not scaling up, not piloting. If there is any global lesson in this pandemic, it is that India may have some vulnerabilities inherent in its geography, its population density, and diversity, but it has greater capacities that can be harnessed and surged. I can give you more numbers. Laboratories expanded, manufacturing for PPEs, etc., etc. There are more. But the summary is this: a prepared India is a prepared world. You can repeat that after me. That is the mantra. Think of that as the baseline for any future pandemic or global public health effort. I believe that what defines this pandemic is the quality and scale of public health response. We heard all our previous dignitaries and speakers. It happened at every level, at national and at community, state, district. India has shown the way. Vaccination coverage at scale was achieved in record time because of the collaborative efforts of Government of India, state and union territory governments, scientists who had these ideas and supporting them to product, to delivery. Vaccine manufacturers, in fact, even before the pandemic, India is already a vaccine superpower. 70% of all the vaccines for regular antigens are produced in India. Partner agencies and the country's highly motivated health workforce, there was no stopping that. And that's the point of how this response and the biggest vaccination campaign in the world has happened. And I thank you all. What also worked was people's participation. It was a Jan Andolan, meaning a real people's movement. Every citizen felt that they had to do something for this, whether it's their opinions, their scientific opinions, etc. It was a very dynamic response. Everybody played their part. Everybody's queries were addressed. Rumors and fears dispelled. And people got vaccinated. Of course, there was hesitancy right at the outset, but it was never forced. I congratulate India's leadership in this, the health workforce and citizens for the success of this biggest vaccination drive. India has also demonstrated exemplary leadership in supporting the global fight to end COVID-19 by exporting COVID-19 vaccines through COVAX. It is for distribution to low and middle income countries to support the world to end the pandemic. As I said, a prepared India is a prepared world. A responding India makes the world's fight successful. We cannot end the pandemic one country at a time. The slide shown by J.S. Lavagarwal has shown that we are still in the middle of one. It is a global goal. We need to reach the target of 70% global vaccination coverage to reduce the transmission of COVID-19 and help new variants from emerging. It is also an individual goal for each one of us. We must continue, as I always say, the 3 W's. Wear a mask properly, wash your hands regularly, and watch your distance, and include the 2 V's, your vaccination and a well-ventilated place. This will all help reduce transmission of SARS-CoV-2. We must accept the new normal to stay safe and move on with all the other health programs that have been delayed or suffered throughout this pandemic. We have to do it with the same scale and surge of efforts. Thank you very much.
Thank you, Dr. Offren. I would now like to invite Ms. Shoko Noda, Resident Representative, UNDP.
Honourable Health Minister, Mr. Secretary, the ICMR Director General, Additional Secretary, Joint Secretary, representatives from different development partners, distinguished guests, ladies and gentlemen. It is my utmost pleasure to be here today. Today we are here to really celebrate India's success as I think the previous speaker said, vaccine superpower, and also to discuss the key takeaways from India's COVID-19 vaccination program. And for that, first, let me India, and especially the Health Ministry, Minister, Secretary, and Additional Secretary, Joint Secretary, and then all the officials here for the most successful drive. That I often talk about it. I feel like I'm already an Indian, and whenever I have a chance to talk about the whole vaccination program, I passionately talk about it, and usually the officials from other countries are very, very impressed. India's COVID-19 vaccination program is unparalleled in the world and has administered about 1.8 billion vaccine doses in record time, and we also heard all the numbers, impressive numbers. It has demonstrated ability to scale up, efficiency, and most importantly, inclusiveness. And also it has provided learning for the rest of the world. I would also like to, of course, recognize the significant contribution by partner agencies such as Gates Foundation, USAID, and our sister agencies, WHO, UNICEF, ADB, and all of you here. UNDP, not only in India, but also globally, is extremely proud to be associated with this work and proud to support the health ministry in implementing COWIN, the digital backbone of India's COVID-19 vaccination drive. And recently when our administrator of UNDP, the head of UNDP globally, had a meeting at the executive board, the first thing he said about UNDP's COVID response was about this India's success, and then also our association with COWIN. We are really grateful for this once-in-a-century successful joint journey in developing a COWIN platform, training for vaccination workers, and operating the COWIN technical helpline. And all the things that we have heard is really a reflection of the government's commitment and Prime Minister's his personal also commitment in mitigating adverse effects of the pandemic. And I do remember participating in one of the COWIN coordination meetings that I think was the Joint Secretary you are chairing, and it has gone into every single matter for how COWIN platform can function. And I also remember having a meeting with Mr. Secretary to discuss the COWIN, and I was so impressed with, again, every single issue was raised, discussed, and solved jointly, and that the commitment was something I have never seen in my professional career. So warm congratulations for that. COWIN has been instrumental in ensuring that vaccines reach people across geographies or to all sections of society through real-time tracking and management of beneficiaries and vaccinations. And I would like to reiterate UNDP's continuous support to the ministry. I think our partnership has only become stronger for the past years, including the time of vaccination, the time of pandemic. We have also worked together to support even the electronic vaccine intelligence network. We have also supported the provision of oxygen plants across 5 states, and other works in the area of non-communicable disease control program, etc. So please be reassured our continuous support, and really. Yes, I would like to reiterate our support for India's COVID-19 vaccination drive, and support the government, all the stakeholders in combating the pandemic. And also, not only in India, but I would like to also stress that we'll be happy to support India's global aspiration in this area. I always say that if India succeeds in achieving SDGs, the world will succeed. And I think this COVID-19 vaccination program is the testimony for India's commitment and also the ability to be successful. So once again, warmest congratulations, and thank you very much.
Thank you, Ms. Noda. I would now like to invite Mr. Yasumasa Kimura, Deputy Representative, UNICEF, India.
Good afternoon. Honourable Minister of Health and Family Welfare, Dr. Mandaviya, Secretary Mr. Bhushan, and Joint Secretary Mr. Agarwal, Dr. Elias, and Mr. Menon, Gates Foundations, and my dear colleagues and other dignitaries. Let me begin by congratulating the Gates Foundation on this landmark event. And thank you for giving UNICEF this opportunity to share our contribution to the world's largest COVID vaccine drive. And the models forged in India that we look forward to scaling up for the rest of the world. We are privileged to stand with India as it reaches the groundbreaking milestone of 1.8 billion doses in arms in 14 months. We also welcome the rollout of vaccines for the category of 12 to 14 years old children as they return to school and their full lives. UNICEF has had the privilege to support the government of India in this work by strengthening vaccine delivery through cold chain gap analysis and the procurement and the distribution of nearly 600,000 cold chain equipment for vaccine storage and transportation at all levels across India. UNICEF has also produced syringes and facilitated delivery of 100 million vaccine doses through the COVAX facility. As a leading partner of the Ministry of Health in communication, UNICEF supported the development and rollout of the National Communication Strategy for Vaccination. We supported a number of Indian models with lessons for other countries. The Hagar Dastak door-to-door vaccine campaign, cluster approach to vaccinate left-out beneficiaries in geographic clusters, pink booth, all-women vaccine booth to enhance coverage among women and the transgender population in Uttar Pradesh. 24/7 clinics and mega camps, mobile teams to cover scattered hamlets in the northeast, and slums and the peri-urban areas in Bihar and Maharashtra. We also reached the most vulnerable population groups through special vaccine sessions in schools for adolescents, in retirement homes for elderly, and in child care institutions for out-of-school adolescents. Behavior change is often about nuance. It was critical that we go to block level based on precise root cause analysis to address hesitancy in low-performing districts. For example, traditional beliefs were identified in some pockets where we engaged religious leaders to address the issue. Networks like self-help groups, tea garden associations, Panchayat Raj institutions, and the youth groups have been the key in spread of vaccine uptake communication. This is the first time in our history vaccines are developed on our footing to reach billions. Mass communication was imperative. UNICEF supported 24/7 media war room at the ministry. TV, print, digital media were used to address misinformation. Working with the government, we supported some 700 radio and TV programs, which celebrated COVID warriors and nudged people to follow COVID-appropriate behavior. I'd like to ensure UNICEF's commitment to India in our support as the vaccine pushes us out of this health emergency. We also believe in India's critical place in defining the trajectory of this pandemic, whether it is an effective communication, making the COVID response people's movements, or innovation in vaccine and infrastructure. And we're very much looking forward to working with you to showcase these lessons to the world. Thank you very much.
Thank you, Mr. Kimura. I would now like to invite Ms. Anjali Kaur, Deputy Assistant Administrator for Asia, USAID.
Good evening. Honourable Minister, distinguished speakers, ladies and gentlemen, it's a pleasure to be with you here today. On behalf of the United States Agency for International Development, as we reflect on India's tremendous efforts to respond to COVID-19 pandemic. Tonight, I would like to build on the valuable insights from my colleagues on stage. Since the outset of the pandemic, USAID has provided more than $9 billion to intensify the fight against COVID-19 around the world and has partnered closely with the government of India to mitigate and respond to the pandemic. USAID is partnering with the government of India to provide life-saving treatments, disseminate public health messages, and strengthen case finding and surveillance. We're helping to deliver more than 11.5 million vaccines through USAID-supported vaccination sites and support frontline health workers so they can continue to save lives across the country. As of the past week, our partnership has benefited more than 87 million people in India. This is an incredible achievement, one that we can all be very proud of. As we know, the government of India is pursuing one of the world's largest vaccination campaigns, serving as a model for other countries. The US-India partnership supports India's vaccination programs and offers many lessons that we hope to share around the world to help countries fast track. Lesson 1. One of these lessons is about the power of inclusion. Marginalized communities must be included in vaccination program design and outreach. Prioritizing these groups can lead to incredible outcomes for some of the most vulnerable people. For example, in January 2022, USAID partnered with local Indian governments and leveraged more than $1.3 million from the private sector to launch a mobile vaccination program. Together, we deployed more than 100 mobile vaccination vans to increase vaccination coverage in hard-to-reach populations. We reached nearly 500,000 people in less than 45 days across India's most underserved districts across Maharashtra, Jharkhand, and Tamil Nadu. USAID is also partnering with the Ministry of Health and Family Welfare and the Ministry of Tribal Affairs to address COVID-19 challenges among tribal groups in India by ensuring that people isolated in their homes are able to receive health services by trained community volunteers and healthcare personnel. Through multimedia street theater, campaigns, and community radio programs tailored to these communities' unique needs. More people are playing their part in preventing the spread of disease, stopping vaccine myths in their tracks, and breaking down social stigma related to the virus and vaccines. For instance, Julie Lakhar, a member of the local Garo tribal community in Assam, said that the lack of proper healthcare facilities and health-seeking behavior distance the vulnerable population from availing quality health care. However, in her role as a health messenger, she's equipping the community with accurate and reliable COVID-19 information. People Julie has worked with are overcoming their fears and getting vaccinated. Through these training programs, USAID helped reach over 500,000 people across 10 districts in Assam with critical COVID-19 information. Lesson number 2. It's also vital that countries develop and maintain strong reporting systems and expand their capacity to collect and report accurate data. They also need robust supply chain infrastructure. In India, USAID worked alongside state health offices to strengthen reporting, improve supply chain management, and expand positive messaging on COVID-19 vaccines. For example, Mukesh Srivastava felt his world was crumbling when he and his family, including his 4-month-old baby, tested positive for COVID. When his breathing suddenly became difficult, he reported his symptoms to the USAID-supported Nishta COVID Sanchar, which is a telehelpline. Within 30 minutes, he was in an ambulance and on his way to a hospital for oxygen support. Mukesh thankfully recovered, and his counselors continue to regularly monitor him for post-COVID-19 complications. Lesson number 3. We learned a third valuable lesson through our collaboration with India's vibrant private sector in coordination with the government of India. These relationships facilitated sustainable market-based solutions, introduced digital technologies, and mobilized private investments to expand mitigation strategies. For example, USAID collaborated with public and private partners to develop Samrid, which is a blended finance facility. Samrid combines public and philanthropic funds with commercial capital to create and scale market-based solutions to improve healthcare services for India's most vulnerable populations. Through high-impact solutions like temperature-controlled shipping containers and mobile health units, Samrid has supported more than 11,000 medical personnel, benefited over 20 million people, and leveraged $300 million in grant and debt funding, based on 10 times the initial investment. Samrid is now expanding vaccine supply chain support in Africa. USAID is also leveraging technology to expand access to healthcare services, including our efforts with TeleTrack across Madhya Pradesh, Nagaland, Meghalaya, Mizoram, and Arunachal Pradesh, and with teleconsultation services through eSanjeevani under the Ayushman Bharat scheme. Lastly, through global platforms such as Covalex Learning Exchange, USAID and the Government of India are maximizing our global impact and leveraging India's expertise in science and technology for the global good. Our joint efforts to enhance information sharing, including lessons learned and accelerating interventions that can help end this pandemic. Today, we look to continue our successful partnership with the Government of India by expanding the existing COVID-19 vaccine learning exchange platform to include new populations like children, other health programs, including routine immunization in new areas of the country. We would also like to create a regional learning platform to share India's experience and expertise on universal health coverage and TB elimination, and establish a digital response center of excellence for COVID-19 and pandemic preparedness to share India's advanced technology globally. We appreciate the Government of India's willingness to partner with us to fight this pandemic. I commend the Indian government's work to overcome the immense challenges caused by COVID-19. We have made tremendous progress and learned much along the way. I look forward to our continued collaboration to share these best practices with the rest of the world. Thank you.
Thank you, Ms. Kaur. With that, I would like to invite our next speaker, Mr. Takio Konishi, Country Director, ADB, India.
Honourable Minister, Honourable Secretary, Honourable Joint Secretary, also President of Gate Foundation, thank you very much for giving us the opportunity in such a wonderful platform, and a very good evening to everyone. It's a pleasure to be taking part of this discussion and lesson learned from India's achievement in operationalizing the world's largest COVID-19 vaccine drive. And despite the huge social, cultural, geographical, and political diversity, India overcame numerous challenges, including political, technical, and operational, and social and epidemiologically bottlenecks to deliver safe and wide-reaching vaccination. Taking this opportunity, I'd like to congratulate India's leadership in mounting a strategic and multi-sectoral and well-prepared response to the pandemic. The empowered group were formed to provide guidance to national and state leadership, an administrative mechanism, technical agency, and healthcare workers and professionals. Efforts were made to proactively engage the private sector and foster strong public-private partnership to execute the whole society in terms of this response. I understand that India has administered 1.8 billion vaccine doses, with 820 million received 2 doses. These underscore the work done collectively by various sector and ingenious strategy adopted, including the near-to-home vaccination, Har Ghar Dastak, and community mobilization, amongst others. Now, India's approach is a shining beacon example that we should all take a lesson from, and this could be replicable and adopted in other settings. I understand that India is providing assistance to several developing countries with regards to IT-based management, such as COWIN, as well as through COVAX or a bilateral basis, in a bilateral basis. I think this whole experience also give a strong notification in terms of achievement in the India's pharmaceutical industries. They have been in the forefront of producing affordable medicine and vaccine. This pandemic showed the proactiveness, as Secretary Bhushan had mentioned earlier, both in the industry support and support from the regulatory authorities, and encouragement from the government to both private and public-private partnership, which generated phenomenal results that we see today. And India has access to several COVID-19 vaccines, which is 3 of them, if I recall correctly, are homegrown. This is something that the country should be very proud of. Now, availability of vaccine alone is not the answer to all, or nor is it a panacea. And I believe that India's success in vaccination over 1 billion people is a accumulation of a scaling up effort to swiftly achieve universal immunization, meeting logistical needs to reach the last person and leave no one behind. This has been really contributed to the numbers that has been already reported by Joint Secretary also. Now, ADB's has been a privilege to be associated in this long journey. Since December 2020, our institution had launched a 9 billion Asia-Pacific Vaccine Access Facility, or what we call the APVAX, which development member country can access as a rapid and equitable support to procure and deliver effective and safe COVID-19 vaccine. And under this facility, India was able to tap into a 1.5 billion loan, which was approved in November 2021. Apart from that, given the expanded and rapid speed that this pandemic was gouging the country, and not just India, ADB came with 1.5 billion COVID-19 active response and expenditure support program to support India's pandemic's response efforts, and another 300 million loan to strengthen the access to comprehensive primary health care in urban area to better respond to the future pandemic and other emergency under PMABHIM. And this was in early 2020. Now, in terms of the assistance, ADB has provided support for policy formulation and program development and capacity enhancement of health system and community engagement in program management using IT system. And the one lessons learned that we have taken from our institution, as well as working closely with the government of India, is how quickly can we respond in a very timely manner. And that has been really shifted our ADB operation to respond quickly in a timely manner. And we continue to be committed to support the health sector by providing pandemic resilient infrastructure at the national and state level, while attracting more private sector and private investment through PPP model. ADB also, we hope that to foster a regional cooperation and taking the lessons from this pandemic, looking at this as a public good for health through Asia, South Asia, sub-regional economic corridor, and cooperation through the regional cooperation initiative. We do see through this experience of the COVID-19, we saw how interconnected this region is, and also how quickly this emergency response would be kind of avoided by a better resilient infrastructure and, shall we say, infrastructure setting. So I hope that we continue to work together in this endeavor, and through this collaboratory efforts, we have been, ADB has been privileged to work not only with Ministry of Health and Family Welfare, but other donor community in a timely manner. And we hope to continue this joint endeavor together to support the government of India. Thank you very much.
Thank you, Mr. Konishi. I would like to invite Dr. Chris Elias, President Bill and Melinda Gates Foundation, to share his perspectives.
Thank you. Good evening. Honorable Secretary, Honorable Minister, Honorable Secretary, esteemed colleagues, dignitaries, it's a pleasure to be with you this evening. And it really gives me immense pleasure to be with you to celebrate India's achievements, remarkable achievements in the rollout of COVID-19 vaccines. This is my first trip to India in 2 years, so I've been observing this progress from a distance. And so I won't go over the numbers you've heard from the colleagues on the panel. Secretary Bhushan gave us some very concise messages, I think, about what works. And Additional Secretary Agarwal gave us a master class in the details of what it takes to actually accomplish this kind of rollout. The one thing I'd say is that, maybe to frame my remarks, is that it wasn't a surprise. I currently chair the board of the Global Polio Eradication Initiative, and it's been over 11 years since India had its last case of polio. And the efforts that it took to achieve that incredible goal, that milestone to over a decade ago, were similar. And you saw incredible coordination, incredible innovation, and that while India achieved a remarkable goal for protecting its population, it also pioneered innovations that we are still using in the final miles of polio eradication, innovations in surveillance, innovations in frontline worker supervision, and innovations in the development and deployment of new vaccines. And so if I think about listening to the comments of colleagues here who know the details much better than I could from a distance, I think there are three key lessons. The first is, and they're all about India's achievement, but also lessons for the world. The first is that I think we've seen in all successful COVID responses that it begins with leadership at the top. So the convening of the National Expert Committee, the daily convenings of the minister, that's the kind of evidence-driven leadership that every country that has done well has had. And India's had that, and I think it's demonstrated that as it succeeded here in India, it developed public goods that are now being used in other places. The COWIN platform for being able to track vaccines from procurement all the way to frontline delivery has served India extremely well, including the DIVOC certification elements of that. Those are things that are now being used elsewhere in Asia as well as in sub-Saharan Africa to help countries with their response to increase the throughput of delivery. No country has delivered vaccines in a day to the population of Australia like India has. So I think that leadership and the development of global digital tools like COWIN have been important public goods that are now serving the rest of the world as well as India. The second, and one thing that I think wasn't mentioned so much by previous speakers, has been the innovations in regulatory science in terms of being able to balance speed with safety. As an important source of vaccines for the world, India's had to face the challenges of being careful and yet fast in evaluating vaccines for emergency use listing. Only a few countries in the world have had to do that, and then the World Health Organization through its pre-qualification and EUL listing process. Many other countries depend on that careful regulatory attention and science. And I think that's another thing to applaud about India's experience. And then thirdly has been, I think it was Balgram who said, India is the pharmacy for the world. And I think that's true in terms of generic medicines, in terms of vaccines, the largest supplier of vaccines for children, not just for COVID. For UNICEF are the manufacturers here in India, many of whom have worked in the face of COVID with strong support from the Indian government. And I think that that's, again, served India well as the world, and I think will continue as we think about what's next. It's not just about making generic medicines, it's about harnessing the front end of science to bring new innovations quickly to scale in an affordable and high-quality way. And I think some of the platforms like mRNA technology that have been pioneered for COVID are going to serve us extremely well for other diseases like TB and malaria and potentially many other causes of significant morbidity and mortality. So, you know, as a development partner, the Gates Foundation has been part to play a small role in partnering with the government in a number of areas of the response. But I really just want to celebrate the achievements of India in the rapid rollout of the vaccines. And then maybe finally say, you know, as we pivot to what the future, I think understanding, I think our WHO colleague said it best, you know, a prepared India is a prepared world. But also, how do we now keep our eye on the ball of the essential health services that have been disrupted by COVID, and to complete the agenda for the SDGs, as Shoko was saying. So we look forward to our continued collaboration. We applaud the success of the rollout of vaccines. We have many other challenges ahead of us, and we look forward to working together. Thank you.
Thank you, Dr. Elias. It is my pleasure to now invite Honourable Minister, Ministry of Health and Family Welfare, Dr. Mansukh Mandaviya ji, to the podium and request him to share his valuable perspectives on India's COVID-19 journey and the key lessons it presents for the future.
मंच पर उपस्थित सेक्रेटरी हेल्थ, सभी इंटरनेशनल इंस्टीट्यूट के रिप्रेजेंटेटिव्स, उपस्थित सभी भाई एवं बहनों, सबसे पहले तो मैं मंच पर उपस्थित सभी इंटरनेशनल इंस्टीट्यूट का आभारी हूँ जिन्होंने इंडिया में कोविड मैनेजमेंट और वैक्सीनेशन को अपनी ओर से सराहा है। दोस्तों, जब कोविड मैनेजमेंट की वैक्सीनेशन रिसर्च से लेके वैक्सीनेशन ड्राइव की जब हम चर्चा करते हैं, डिस्कशन करते हैं, तब 2-3 पहलू उसमें होती है। सबसे पहले वैक्सीन रिसर्च, वैक्सीन एडमिनिस्ट्रेशन, मैनेजमेंट और एफर्ट। उसके लिए इंडिया में कभी साइंस की कमी नहीं थी, कभी ब्रेन पावर की भी कमी नहीं थी, मेन पावर की भी इंडिया में कभी कमी नहीं थी। Our traditional life is always scientific. You go to our kitchen में स्पाइसेस होती है, वो हमें हमारे हेल्थ के लिए यूज़फुल हो, ऐसी ही हमारी किचन में जो रसोई बनाने के लिए, कुकिंग के लिए जरूरी है, वही चीज है। You go to our any house and you see our family system, joint family system, it is also a scientific management. ये भी एक scientific व्यवस्था है। You go to any house, you go to any villages, सभी घर में एक तुलसी का प्लांट होता है। It is scientific plant to use of our health. इंडिया में साइंस की कभी कमी नहीं थी। Our social management, our social engineering, ऑल आर साइंटिफिक। सवाल इतना ही था केवल, आज मुझे खुशी है सब लोग अच्छी तरह से इंडिया की वैक्सीनेशन ड्राइव को सराह रहे थे। उसके पहले जब कोविड का फर्स्ट वेव दुनिया में आया तो मैंने एक न्यूज में एक बहुत बड़े व्यक्ति ने, इंटरनेशनल व्यक्ति ने आर्टिकल लिखा था और उसमें लिखा था कि इंडिया की हालत क्या होगी। वो दुनिया का एक्सपेरिमेंट, कोविड का विपरीत परिणाम कितना बड़ा होगा वो इंडिया के ऊपर डिपेंडेंट होंगे। इस तरह से उन्होंने अनुमान लगाया था कि इंडिया में ये होगा तो इंडिया में ये हो जाएगा, ये हो जाएगा, ये हो जाएगा। इस तरह से उन्होंने अपनी असेसमेंट लगाई थी। और जब कोविड दुनिया में फैला, सारी दुनिया में आया, इंडिया में भी आया। और उस वक्त एक डिसिसिव लीडरशिप ने इंडिया में क्या किया, समय के आधार पर समय समय पर डिसीजन लेना, साइंस को प्रोत्साहित करना, साइंटिफिक डिसीजन लेना, समय पर देश में पब्लिक अवेयरनेस करना। इट इज नॉट ओनली फॉर इंडिया बट एंटायर वर्ल्ड, इट्स वन टाइप ऑफ स्टडी केस। और हमारा नेचर रहा है, हम दुनिया में बेस्ट है। हमारा शास्त्रों ने कहा है कि संसार में जो भी कुछ अच्छा है उसको सीखो, ग्रहण करो। हमारा संस्कार है, दुनिया में जो भी कुछ अच्छा होता है हमने समय समय पर दुनिया से सीखा है। और हम कुछ अच्छा करते हैं या तो हमारे पास कुछ अच्छा है तो हमने कभी उसके पर अभिमान नहीं किया है, हमने उसको बांटा है। हमने कहा है कि हमारे पास कुछ है तो हमने केवल हमारी प्रॉपर्टी नहीं देखी है। हमने कभी इरोगेंट बिहेवियर नहीं किया है कि हमारे पास है, नहीं, हमारे पास है तो हमने दुनिया को बांटा है। जब फर्स्ट वेव चल रहा था दुनिया के पास हाइड्रोक्सीक्लोरोक्विन नहीं थी और सारी दुनिया चाहती थी हमें हाइड्रोक्सीक्लोरोक्विन मिले। कोविड के लिए यूज फुल ऑल टाइप ऑफ मेडिसिन, हाइड्रोक्सीक्लोरोक्विन, एजिथ्रोमाइसिन, नंबर ऑफ टाइप ऑफ मेडिसिन दुनिया के पास किल्लत थी। उस वक्त इंडिया में लॉकडाउन था। मोदी जी ने मुझे कहा था कि लॉकडाउन है लेकिन भी सभी फार्मा इंडस्ट्रीज के साथ मीटिंग करो और फार्मा इंडस्ट्रीज को कहो कि मैन्युफैक्चरिंग बढ़ाए, उसको कोविड पास दे दो, उसके सभी एम्प्लॉइज आए और मैन्युफैक्चरिंग चालू होना चाहिए क्योंकि इंडिया की रिक्वायरमेंट को हमें को तो पूरी करना है लेकिन दुनिया को हमें मदद करनी चाहिए। विपरीत परिस्थिति में दुनिया के साथ हमें रहना चाहिए। हमने उसके पास दुनिया को क्वालिटी मेडिसिन, क्वालिटी में बार्गेनिंग नहीं किया। एफोर्डेबल मेडिसिन, दुनिया के पास मेडिसिन नहीं है इसलिए ज्यादा पैसा लो, ऐसा नहीं किया। हमने कोई ऐसा एग्रीमेंट नहीं करवाया और नहीं कोई ऐसे एग्रीमेंट पर साइन करने के लिए किसी को कहा। दुनिया की जरूरत है, हमारा दायित्व है, हम दुनिया को मदद करने के लिए रेडी है। 150 कंट्री में इंडिया ने उस वक्त हाइड्रोक्सीक्लोरोक्विन और जरूरी मेडिसिन का सप्लाई किया था। हमारे पास जो कुछ है, और हेल्थ को तो कभी हमने व्यापार के साथ, बिजनेस के साथ नहीं जोड़ा है। हेल्थ हम हिल बाय बोलते हैं, ये हमारा दायित्व समझते हैं। हम दूसरे को कैसे मदद करें, प्रायोरिटी व्यापार नहीं है। दोस्तों, हमने देश में वैक्सीन का मैन्युफैक्चरिंग किया, वैक्सीन का रिसर्च किया, इंडिया की रिक्वायरमेंट पूरी हुई और उसके पहले हमने दुनिया को भी मदद करना शुरू किया। तो हमने दुनिया को ऐसा नहीं कहा, दुनिया में शायद $20-25 का पर डोज वैक्सीन मिल रहा था। हमने ऐसा नहीं किया कि हम आपसे $20-25 पर डोज लेंगे। हमने $3-4 पर डोज दुनिया को सप्लाई किया। ये हमारा नेचर है, ये हमारी कार्य प्रणाली है। दोस्तों, दुनिया में कई कंट्री में आपने देखा होगा ड्यूरिंग कोविड डॉक्टर, नर्सिज ड्यूटी छोड़ के चले गए थे। दोस्तों, एक डिसिसिव लीडरशिप ने देश के डॉक्टर्स, देश के हेल्थ वर्कर्स सभी को एड्रेस किया, कहा कि विपरीत परिस्थिति में हमारा दायित्व है हम देश के नागरिकों की दुनिया को सीखने जैसा एग्जाम्पल है। दुनिया ने, हमने तो कई बार इंडिया को तो एडवाइस दी है। इंडिया कभी किसी को एडवाइस नहीं देता है। इंडिया इज नॉट गिविंग टू एडवाइस टू द वर्ल्ड, बट हम जो करते हैं उसमें किसी को सीखना है तो सीख तो अवश्य सकते हैं। हमें कैसी भी कंट्री में गिने जाए, लेकिन भी कोविड मैनेजमेंट में आपने देखा, हमारे प्रधानमंत्री जी ने कहा सभी को, मेरे डॉक्टर्स, मेरे हेल्थ केयर वर्कर्स, मेरे एनजीओज, सभी को हमें हमारा दायित्व अदा करना है। देश के नागरिकों की सुरक्षा के लिए, हेल्थ के सामने सुरक्षा के लिए हमें डटे रहना है। हमारे कई डॉक्टर्स, हमारे कई नर्सिस अपने स्वयं को खपा दिया। वो स्वयं दुनिया में नहीं रहे, देश के नागरिकों की सेवा करते हुए, लेकिन देश के कोई नागरिक को ऐसा नहीं हुआ कि जिस कोई डॉक्टर ने कहा हो कि मैं आपकी ट्रीटमेंट नहीं करूं, कोई नर्सिस ने ऐसा नहीं कहा कि मैं आपकी ट्रीटमेंट नहीं करूं। ऐसा ही, इतना ही नहीं, उसको प्रोत्साहित करने के लिए, उसका हौसला बढ़ाने के लिए, उसको इस काम के लिए उसका कमिटमेंट बने रहे, प्रोत्साहन की बहुत आवश्यकता होती है। और हमारे लीडरशिप ने, हमारे प्रधानमंत्री जी ने देश में हमारे एयरफोर्स के प्लेन को उड़ा के ट्राई कलर से मेरे हेल्थ वर्कर का हौसला बढ़ाया। आप देश के लिए जो कर रहे हैं, हम आपकी इज्जत करते हैं, हमें आपके ऊपर नाज है, हमें आपके ऊपर गौरव है। उसके लिए देश के सभी नागरिक ट्रीट में आए। ऑल सिटीजन कम्स ऑन ट्रीट एंड थाली और ताली बजाई, थाली बजाई, ताली बजाई, उसका हौसला बढ़ाया। दोस्तों, ये इंडिया ने इतना, इंडिया इज ए बिग कंट्री, ह्यूज डाइवर्सिटी, इतनी बड़ी कंट्री, अलग अलग ट्रेडिशन, नंबर ऑफ टाइप ऑफ लैंग्वेजेस, इतना डाइवर्सिटी होने के बाद, इतना पॉपुलेशन होने के बाद, यहाँ अमीर भी है, यहाँ गरीब भी है। एक होलिस्टिक मैनेजमेंट कैसे हो सकता है, उसका बेस्ट एग्जांपल इंडिया है। यहाँ पर डे करोड़ों लोग ऐसे हैं जो दिन का कमाते हैं और दिन का उसका जीवन निर्वाह पर डे होता है। दिन की कमाई, दिन का खाना होता है। दोस्तों, इतना बड़ी क्राइसिस में 1.5 महीने तक लॉकडाउन रहा, देश में कभी किसी को भूखे सोने का नौबत नहीं आई। सभी को समय पे खाना मिला, समय पर डिसीजन करके। जब हमने लॉकडाउन किया तो हमने सारी व्यवस्था को ध्यान में रखते हुए, देश के गरीब लोगों के यहां भी कोई दिक्कत नहीं होनी चाहिए। सरकार की ओर से तो सरकार ने एफर्ट किया, लेकिन हमारी सामाजिक व्यवस्था भी इतनी साइंटिफिक है, हमारी सोच भी इतनी साइंटिफिक है कि वो केवल अपना ही नहीं सोचते हैं, वो अपना भी सोचते हैं और दूसरे का भी सोचते हैं। सरकार की ओर से, गवर्नमेंट की ओर से कोविड पैकेज के तहत दोस्तों 1898 जब दुनिया में प्लेग आया था, और उस वक्त इंडिया में भी प्लेग आया था, और ये प्लेग में लोग जितना प्लेग से नहीं मरे थे, उससे ज्यादा भूखमरी से मरे थे, खाना नहीं मिला था। ये जब क्राइसिस होती है तब ये टाइप की समस्या खड़ी होती है, लेकिन इंडिया में जिस तरह से कोविड मैनेजमेंट हुआ और उसमें जॉइंटली एफर्ट गवर्नमेंट की ओर से गवर्नमेंट ने किया, ऑल हमारे इंडस्ट्रीज प्लेयर की ओर से कहा मैं देश के लिए क्या कर सकूं, उन्होंने अपनी ओर से किया, एनजीओ ने अपनी ओर से किया, और आम नागरिक ने अपने पड़ोस में कोई गरीब है, भूखा नहीं सोया है ना, उसको भूखे सोने की स्थिति नहीं है ना, उसकी चिंता पड़ोसी ने भी अपने पड़ोसी की। ये कोई चाहे तो उससे सीख भी सकते हैं। और दुनिया में 97, इंडिया में 97% 50 एबव लोगों को फर्स्ट डोज एडमिनिस्टर हो जाना। दोस्तों, इसलिए ही हम थर्ड वेव में हमारा वैक्सीनेशन ने हमें सहयोग किया। देश के नागरिकों ने वैक्सीन लगवाया, उसके लिए व्यापक पब्लिक अवेयरनेस गवर्नमेंट और सोसाइटी ने साथ में मिलकर किया। और दोस्तों, इंडिया इज ए फेडरल डेमोक्रेसी, बड़ी कंट्री है, और फेडरल डेमोक्रेसी स्टेट है, अपनी अपनी गवर्नमेंट है, और अपने अपने स्टेट में अपना रूल्स रेगुलेशन बनाने का उसका अधिकार है। लेकिन सब लोग साथ में मिलके, इतनी विविधता में भी साथ में मिलके कैसे एफर्ट कर सकते हैं, उसका बेस्ट एग्जांपल कोई उसके ऊपर साइंटिफिक स्टडी करके लिख सकते हैं। ये छोटी बात नहीं है। स्टेट गवर्नमेंट और सेंट्रल गवर्नमेंट ने साथ में मिलके कोविड मैनेजमेंट और कोविड क्राइसिस के सामने जो लड़ने की एक रणनीति की, और उसमें जिस तरह से हमें सक्सेस मिली है, मुझे लगता है कि हमारे लिए तो गौरव की बात है ही। और मैं पोलाइटली कहूँगा, हम किसी को सिखाते नहीं हैं, लेकिन हम सबसे सीखते हैं। कोई उसको अच्छी तरह से देखे तो उसमें आज के लिए नहीं, आने वाले दिनों में, भविष्य में कोई ऐसी क्राइसिस होगी, हम चाहे कि ना हो, लेकिन भी होगी, तो एक सिलेबस के रूप में उसका उपयोग हो सके, ऐसी सक्सेस स्टोरी तो निश्चित तौर पर इंडिया ने करके दिखाई है। इस कार्यक्रम को ऑर्गेनाइज करने के लिए सभी ऑर्गेनाइजर का मैं आभारी हूँ। सब लोग यहाँ आके अपने अपने एक्सपीरियंस हमारे सामने शेयर किया, उसका भी मैं आभारी हूँ। और आप सब लोगों को मेरी ओर से हार्दिक शुभकामनाएं। धन्यवाद।
With this, we are coming to the close of the session. On behalf of the Bill and Melinda Gates Foundation, I would like to thank Honorable Health Minister, Dr. Mandaviya ji, Secretary Shri Rajesh Bhushan ji, Director General ICMR, Dr. Bhargav ji, Additional Secretary Manohar Agnani ji, Joint Secretary Love Agarwal ji, and all the other partners who have joined us today. Lessons learned from today will put us in good stead when it comes to managing future pandemics, but also towards building strong health systems. It was a pleasure to host you, and I look forward to seeing you again. Thank you so much.
Thank you everyone for joining us today. Dinner will be served in Diwane Khar shortly. We look forward to hosting you at another Aksha event soon. you.